Greetings, greetings. Today we are
Hello.
today we are going to talk about shoulder pain that will not go away. It just hangs on there. We're going to give you three options to help get that figured out so you can get back to life at normal and pleasantly again.
It's kind of like you at a party, you won't go away.
Yeah. I've experienced that, Bob. 9 seconds.
Bob and Brad, the two most famous physical therapists on the internet.
Number one. Now, Bob, both you and I have experienced this with a number of patients. They got
Right.
shoulder pain, they won't go away. And then you get into it, we find out that they end up sleeping on their shoulder from time to time.
Very often.
Yeah, like once a night, they wake up with pain, they roll around, and then it's okay. But while they're lying on that sore shoulder, irritating it, and getting painful to the point where it wakes them up, the damage is already done.
Right.
You get it better throughout the day, and it goes backwards because you're lying on it. So, what you want to do is sleep on the opposite side. This will be Bob's sore shoulder.
Ow, ow, ow,
Ow, ow, ow. Take two pillows. Don't not only just
ow.
avoid
One,
sleeping on that
two.
side, is put the pillows in just like that.
Now you can also, I did this before, Brad.
Yep.
You can actually just lay the arm on your body.
Sure. Yep. Do whatever makes the shoulder feel relaxed and comfortable. You'll know because it's going to feel good.
A different option would be actually to take, if you're going to sleep on the
Yeah.
shoulder.
I had this one guy, he says, I have
can't
to,
do,
I
right.
have to sleep on that side. I've
I
been
see
doing
that
it for
all the
50
time, Brad.
years.
Yeah.
Yep.
So in this case, we're going to get a throw pillow and we're going to create a canal and we're actually going to lie down and actually keep the shoulder in the gap. And I'm putting the pressure more on my head and on my chest.
And notice Bob has two pillows to help keep his head up so the neck is in proper
Right.
alignment. So that
Yeah,
can,
this feels good, Brad.
and you do this regularly,
I
right?
do it regular every night.
We've got a regular here. All right, we're going on to number two. Okay, number two, shoulder pain going on for months and months. And if the symptoms are consistent with this, you lift your arm up, it hurts, but once you get it up to a certain level, it
It
feels
feels
better
good,
again.
right?
That's called painful arch syndrome. The majority of the time, it's from an impingement problem
Right.
with your supraspinatus tendon. We're not going to get into the details with that, but we're going to show you a few different options that can successfully. Boy, Bob, my speech, I said that.
Very good.
Yeah, that Freudian speech. Anyways, we're going to correct that. The first one is hanging. Now, we're talking about hanging like from
Pull-up bar,
bar,
a branch, a
branch.
rafter.
Yeah, and this isn't something we just made up. This is
Right.
actually from an orthopedic surgeon who did surgery on shoulders,
Dr. Hirsch.
Dr. Kirsch, and he
Right.
found out that he actually had people do this treatment,
Right.
and actually he lost business because his surgeries
Right.
went down, but the people were happy. They had a shoulder fixed without surgery.
This is called shoulder pain, the solution and prevention.
Right. So actually, the part going up against the wall is something Bob and I added because we think it's a little beneficial. But you
Right.
can do this on a pull-up bar. You'll start here where there's no traction or pulling on your shoulders. And then you slowly go down and see how it feels. There will be some pain involved with this. You may only hang for 10 minutes or 10 seconds at first.
So what are these called, Brad?
Oh, those are my hands.
No,
The hanging handles.
right.
Yeah, we do have, look below and you'll see.
Not hanging.
Yeah, we're hanging our bodies through our wrists and hands. So
Right.
I'm going to not only go 50% maybe to start with.
Sure.
I'm using my legs to control the amount of intensity of the pressure on the shoulders. And then, 10 to 20 seconds, you want to work up to 30 seconds or even a minute.
Right.
And, Dr. Kirsch talks about people hanging for maintenance
Long time.
long time, but I'm
Right.
telling you, I'm not going there. I do
don't
this
know
on a
anybody
regular
who does
basis.
a long time.
Yeah. What did you say? I couldn't hear you.
I don't know anybody who did it for a long time.
No, with the
Yeah.
exception of that in the book.
Right.
The guy said he's going for 5 minutes. but cool.
It's a big guy.
Yeah. So I go to the point where I go full weight like this now for maintenance. But if you're working on your impingement, you may start this, and it may take a week or 2 weeks or more before it improves, but you'll feel improvement along
And
the
you can
way.
do it throughout the day,
Yeah, exactly.
more than
Right.
once.
Okay, next one is going to be the Statue of Liberty, which actually I coined this. It's a treatment that is similar to the hanging, but you don't need to hang. You do need a stick, 4 to 5, probably 5 feet long is going to be better. We use a booyah stick; it works really well. You don't need one. You can use a broom handle,
right?
a piece of dowling, a piece of PVC pipe from the hardware store. One thing that's important is that the stick does not slide, whether you start with it on the floor or you put it on the chair like
Right.
this. So the idea is we want to bring the hand up on the
As
PVC
far as possible.
on the stick as far as you can, and then we want to stretch it similar to the hanging exercise. Now, when I lean forward, Bob's doing it from that position up on his seat pan or on the table there. You'll feel the shoulder being stretched, giving it some traction. The higher you go, the
You
more.
can walk your way up.
Yep. Now I've gotten it on the floor. I'm as high as I can go, and it's like, that's not enough. Well, then just bring it up to the chair. As long as this end does not slide around, you're in good shape. And then you can really get more aggressive.
Again, this can be done throughout the day.
Yep. You'll do no more than 10 stretches, and you can hold it longer if you'd like, 10, 20, 30 seconds. Again, it may be painful, but it should not irritate it when you're done.
Right. And you can really get some torque on it.
Yes, you can. Don't overdo it. That's the big thing. Take your time with it day to day and allow that to stretch out and help itself. So now we're going to go to another one. Now, again, you're going to need that same stick, 5 feet long. It needs to be relatively strong. So if you have a broomstick, make sure it's not kind of rotted. But Bob is going to demonstrate. This is one that Bob has figured out that worked really well for his shoulder. I do it now as well.
So this is the painful shoulder, and the palm is out,
that way.
And the opposite arm, the palm is forward. And you're not going to hit yourself on the head. You're actually going to go up beside the head.
Let your wife do that.
Yeah. And you're going to actually bend up like this. Now, if your shoulder has a tendency to dislocate, you're not going to do this one.
Yeah. Should not be painful. And
Right.
I think the
Feel
way
fine.
to do this is with your painful arm, see how high you can reach. If it's painful at this point, do this stretch.
And don't actually go like this.
Yep.
You're going to just crank the arm.
Yep. Do it 4 or 5 times and then repeat this motion.
Right.
If it's the right thing, it's going to feel better and it's going to go higher with less pain. Then you know you got the right
Again,
stretch.
you can do it throughout the day.
Right, exactly. Moving on. Okay, now an important component of correcting that shoulder pain with impingement is strengthening,
Right.
getting the rotator cuff to work properly again. 2 of the popular exercises are almost all therapists. I think everyone gives these 2. One is scapular retraction. It works really good if you have some bands, anchor it to whatever you have, a bedpost. We're using the wall anchor, and we're going to pull back and squeeze the shoulder blades together and down. Think of putting your shoulder blades into your
Back pockets.
pockets. Yep. So they're going down and like this. And you're going to do 10 to 15 of those. And then what I have my patients do right after that is external rotation. This specifically gets some posterior muscles. I'm going to have my elbow here, 90-degree
side.
bend, and then I'm going to externally rotate it like this. We're going to do 10 to 15 of those. If it's too easy, then bands are wonderful. You just step farther away. Nothing's happening with this hand. It's just
And
an
you keep
anchor.
that elbow in, Bart. Right.
Yep, exactly. Don't let this happen. Don't let this happen. 2 common mistakes. We're doing this. Now, something I just learned with my shoulder, which has been bothering me for 2 years now,
Right.
associated with my swimming habit, is I found out I couldn't do this at all because it was really painful right here, and it was going on for at least 8 months. So I couldn't do my strengthening exercise. So I found out what I did is I put my finger right over that painful spot, and I kind of start pushing in there, and I found out I could do this. My pain was at an 8/10 without the pressure. Put the pressure there, went down to about a 2, and that started about 2 months ago, and now I don't need to put pressure there at all. and I can do my external rotation. My shoulder's getting better as a result of it. It's a mulligan
Wow.
technique, basically, isn't it? Wouldn't you say?
Well, kind of.
Similar.
Yeah.
All I know is it worked wonderful.
So pass it
It was a
on.
game changer.
Right.
So yeah, I want to pass it on. It's something you can try. So there you go. Stretch the shoulder out properly, strengthen it, and don't sleep on it.
Right.
Yeah. So those are big game
It'll
changers.
get better.
We really want your shoulders to be healthy, fit, and pain-free, so
Yeah.
that you too can experience joy in your life, and you do not become.
Okay, we're done.
Okay.